Stress management. There isn't a single easy answer to reducing our levels of stress. Removing the cause of the stress would be effective, but it's not always possible. We may have to change the way we think about the stress, and such methods are known as cognitive or psychological coping strategies. We may be able to use medication and biofeedback. These are physiological methods. Psychological methods to cope with stress. In 1977, Mitchenbaum developed stress inoculation. Just as vaccination works by giving someone a weakened form of a pathogen, this involves being exposed to potentially stressful situations and learning how to deal with them. There are 3 steps to this. Conceptualization. That is, working with a therapist and identifying your fears. Next, skill acquisition and rehearsal. So you develop relaxation skills and positive thinking. And lastly, application and follow-through. So you have to practice skills you've just learned in real-life situations, starting with low-stress situations and working up to high-stress situations. The problems or weaknesses with this approach is that it probably only works if the individual is determined enough to overcome his or her problems in the first place. This is because it needs a lot of time and commitment. Anyone determined enough to undergo this training probably has quite good coping mechanisms in the first place. In 1979, Kobasa suggested that different personality types would respond differently to stress, some becoming ill and some resilient to stress. The resilient ones were referred to as hardy. A hardy person shows control over their lives, commitment, a strong sense of purpose, challenge, sees problems as a challenge rather than as a threat. Kobasa looked at the health of lots of American executives and divided them into 2 groups. One group had high levels of stress and illness. The other had high levels of stress and no illness. She assessed the hardiness of both groups and found that those who weren't ill were hardier than those who were ill. However, the weakness with this is that white middle-class American business people are not representative of all people, so these findings can't be generalized to others. Also, what does lack of hardiness really mean? Perhaps these people are more negative in their outlook, and this may have various knock-on effects upon their health. It is also very difficult to assess personality types. People have to self-report and may respond to demand characteristics. So they answer questions in the way that they think the researcher wants them to answer, or they show themselves to have the qualities they would like to have. We all have many facets to our personalities, and these can change according to our time of life, experiences, and situations. Physiological methods to cope with stress. There are various drugs that can slow the activity of the nervous system and make us feel relaxed. Anti-anxiety drugs, such as benzodiazepines, can do this. The sympathetic nervous system makes the heart rate and blood pressure increase. Beta blockers can slow the effects of the sympathetic nervous system, so they counteract these changes. Drugs can be prescribed by a doctor, and they act quickly. But they only really treat symptoms, not the cause of the stress, and they may themselves cause problems, such as side effects, or be addictive. Another physiological method used is teaching people to relax. They can be attached to machines that monitor changes in blood pressure and heart rate. They then relax and breathe deeply and see that their heart rates and blood pressure fall, so using biofeedback. This acts as a reward, as they now know what to do to reduce the symptoms of stress in real-life situations. This doesn't have side effects like drugs, but it requires some effort on the part of the subject. It also needs equipment and supervision. but it's not as lengthy or difficult as stress inoculation, and you could probably do it without the equipment. Next time you feel stressed, try relaxing and breathing deeply. If you also imagine being somewhere nice, like a beach on a tropical island, you may begin to feel better and be able to cope with stress. We're all different and use different ways of dealing with stress. We can change the way we think about things and learn to be positive and see problems as opportunities or challenges. Then we can feel good about ourselves and be better able to cope with tomorrow's challenges. We can view all experiences as positive, as however bad they may be, we can learn from them and become stronger.